Monkeypox spread likely enhanced by sex at 2 raves in Europe, Driving Who Council says. A Maine counselor to the World Health Organization portrayed the extraordinary episode of the uncommon sickness monkeypox in created nations as an irregular occasion that may be made sense of by unsafe sexual way of behaving at 2 late mass occasions in Europe. In a meeting with the Associated Press, Dr. David Heyman, who previously headed WHO's Crises Division, said the main hypothesis to make sense of the spread of the illness was sexual transmission among gay and sexually open men at 2 raves held in Spain and Belgium. Monkeypox has not recently set off far-reaching episodes past Africa, where it is endemic in creatures. We know monkeypox can spread when there is close contact with the injuries of somebody who is contaminated, and it appears as though sexual contact has now intensified that transmission, said Heyman. That denotes a critical takeoff from the sickness ordinary example of spread in focal and Western Africa, where individuals are chiefly contaminated by creatures like wild rodents and primates, and flare-ups have not spilled across borders. Until this point, WHO has recorded in excess of 90 instances of monkeypox in 12 nations including Britain, Spain, Israel, France, Switzerland, Australia and the US. In the US, up until this point, the CDC says there is 1 affirmed case in Boston. There are likewise thought cases in Broward County, Florida, and New York City. The infection is spread through body liquids, skin, and respiratory beads. It's essential to realize that this infection truly requires close private contact, said Dr. Anne Rimoin, teacher of the study of disease transmission at the UCLA Fielding School of Public Health. She told CBS News boss clinical journalist Dr. John Lopuk, "It's surprising that we are seeing cases occurring in a few nations simultaneously. We've never seen that." Madrid's senior well-being official said on Monday that the Spanish capital has recorded 30 affirmed cases up to this point. Enrique Ruiz Escudero said specialists are exploring potential connections between a new gay pride occasion in the Canary Islands, which drew exactly 80,000 individuals, and cases at a Madrid sauna. Heyman led a dire gathering of WHO's warning gathering on irresistible sickness dangers on Friday to survey the continuous scourge and said there was no proof to propose that monkeypox could have changed into a more irresistible structure. Monkeypox normally causes fever, chills, rash, and sores on the face or privates. It tends to be spread through close contact with a contaminated individual or their attire or bedsheets, however sexual transmission has not yet been recorded. A great many people recuperate from the infection in no less than half a month without requiring hospitalization. Immunizations against smallpox, a connected illness, are likewise viable in forestalling monkeypox, and a few antiviral medications are being created. Lately, the illness has been lethal in up to 6% of diseases, yet no passings have been accounted for among the momentum cases. WHO said affirmed cases have so far been the less serious West African gathering of monkeypox infections and gave off an impression of being connected to an infection that was first recognized in sent-out cases from Nigeria to Britain, Israel, and Singapore in 2018 to 2019. The UN organization said the episode is an exceptionally surprising occasion, and said the way that cases are being seen in such countless various nations recommends the illness might have been quietly spreading for quite a while. The organization's Europe chief cautioned that as summer starts across the landmass, mass social events, celebrations, and gatherings could speed up the spread of monkeypox. Different researchers have brought up that it will be challenging to unravel whether it is sex itself or the nearby contact connected with sex that has driven the new spread of monkeypox across Europe. Commonly, sexual action includes close contact, which one would hope to improve the probability of transmission, whatever an individual's sexual direction and regardless of the method of transmission, said Mike Skinner, a virologist at Imperial College London. On Sunday, the Central Clinical Counselor of Britain's Health Security Agency, Dr. Susan Hopkins, said she expected more monkeypox cases to be distinguished in the country, consistently. UK authorities have said a striking extent of the cases in Britain and Europe have been in young fellows without really any set of experiences of movement to Africa and who are gay, sexually unbiased or have intercourse with men. Experts in Portugal and Spain likewise said their cases were in men who generally had intercourse with different men and whose diseases were gotten when they looked for help for sores at sexual well-being facilities. Heyman, who is likewise a teacher of irresistible sicknesses at the London School of Hygiene and Tropical Medicine, said the monkeypox flare-up was reasonable and irregular occasion that may be detectable to a solitary contamination. Truly conceivable there was someone got contaminated, created injuries on the privates, hands or elsewhere, and afterwards spread it to others when there was sexual or close, actual contact, Heyman speculated. And afterward there were these global occasions that cultivated the episode all over the planet, into the US also, other European nations. He underlined that the illness was probably not going to set off far and wide transmission. This isn't COVID, he said. We want to dial it back, yet it doesn't spread in the air and we have antibodies to safeguard against it. Heyman said examinations ought to be directed quickly to decide whether monkeypox could be spread by individuals without side effects and that populaces in danger of the illness ought to avoid potential risk to safeguard themselves. CBS News Dr. Lapuk concurred. This ought to be treated in a serious way, and it is being viewed in a serious way by general well-being authorities, Lapuk said. However, recall, this is altogether different than COVID. At the point when the pandemic began, SARS-CoV-2, which is the infection that causes COVID, we didn't know anything about it, it was a fresh out-of-the-box new infection. We had no therapeutics, we had no immunizations, we knew nothing about that sickness. This is totally different. We've known about monkeypox for over 60 years. There are immunizations, there are therapeutics, we have a ton of involvement managing it, positively in Africa. Likewise, he noted, toward the start of the pandemic, it was spreading without individuals acknowledging it, they were asymptomatic. Monkeypox has a trademark rash. It would be difficult for it to spread generally without us being familiar with it. Moving news.